Hello, and welcome to the Medicare Team podcast. My name is Thomas Fulmer, and I'm joined here by my coworker, Jack Oram. And today we are going to really dive deep into what the ancillary products we offer are and how they can help you out and protect yourself. God forbid, any afflictions, anything like that. So, Jack, I know that we, help a lot of people out with hospital indemnity plans.
hmm
Can you kind of explain, in depth about how those work, and who they're, really for and how they can benefit those people?
Sure. Well, first and foremost, a hospital indemnity plan would tie best with either one or two coverages. The first would be either through a Medicare Advantage coverage or through your actual employer coverage. So those are two different routes that you could go with, and that's who it exactly fits and ties to.
Yeah.
And here's what a hospital indemnity plan would do for you. What it does is it basically reimburses you your copays or co-insurances when it comes to like your outpatient surgery, ambulance, emergency room, rehab,
And
or
then,
in hospital stay.
right, the inpatient, that's the big out of pocket cost that, I think actually statistically that is the highest, out of pocket cost or unexpected out of pocket cost that comes with, that seniors don't expect when they're on Medicare Advantage
It's not
plans.
even just seniors nowadays, TJ.
Yeah.
It's actually people that, that are working and busting their butts.
Yep.
And, like a lot of people are now, suffering from the high inflation rates that are going on today.
Hmm.
And, it could take even for somebody who's just our age, even if they have one fall, one accident, one hospital ride, this policy would actually pay for itself.
Yeah.
Because what it really does is it actually protects your money. It actually gives you the peace of mind of knowing that you can go to the doctors now, because a lot of people actually have that fear as well. Like, oh my God, I can't afford this bill. What am I going to do? Well, I'm just going to suffer through the pain. And, a lot of the times that's what leads to a lot of longer term injuries,
Yeah.
even with people our age.
Of
So
course.
that's something that's and obviously people that are of the Medicare age and
Yeah.
just about for anybody, it's just a way to properly protect yourself. And I'm just going to go briefly into like what the advantages are for this. Generally, the range for a hospital indemnity plan is anywhere between 30 and about $70 a month. And what it does for you is it actually reimburses you 30 days after you submit your doctor's bill.
Yeah.
So what happens is when you submit the doctor bill, you have a check cut back to you for what it is that you paid out.
Yeah.
And the advantages that come with that is you can think of it almost like with like if anybody's ever had a car payment and had like gap insurance, it works the same way if you've been in an accident. It's as though like you paid the car in your name.
Yeah.
It does the same thing in the insurance world where it goes to your max out of pocket. So therefore, it would look like for you, if you say you had an in-hospital stay, which you're a young, healthy man, but you never know, you can come down and succumb from something as well. Your in-hospital stay is, let's just use $400 a day for 5 days. You stayed in the hospital for 5 days, that would be $2,000 out of your pocket. And if it's $2,000 out of your pocket, once you pay the bill, 30 days from now, the $2,000 comes back to you in a check form.
Yep.
So that's exactly how it is that the hospital indemnity works and what it does for you.
Yeah.
These are the things that'll give you absolute peace of mind, and they connect again best with an advantage plan or even an employer plan, like what it is that we have everyday working people.
Yeah. Of course. Yeah. You explained that really well. Um, you know, Getting more into that and why it works well with Advantage plans is because, as we've talked about before with the two types of Medicare plans that people are usually on, their Advantage plans or their supplement plans. Supplement plans, hospital indemnity plan wouldn't really be very beneficial to you at all, only because your copays for the hospital or coinsurance, that's all taken care of by your supplement plan. You pay the monthly premium for the supplement plan, and your hospital stays are taken care of. So a hospital indemnity plan wouldn't make sense there. But with Advantage plans, like I said, they do have the highest, that looks like the highest out of pocket cost for Advantage plans. So being able to, fill that gap with a hospital indemnity plan and have your money protected, just one less thing to worry about already on top of whatever you went to the hospital for. You don't have to worry about your wallet being, taken out of. So I do recommend that for everybody that is on an Advantage plan that can afford it.
Sure, and the types of there's also types of Medicare Advantage plans that you could certainly pair with a hospital indemnity, which
Yeah,
would be
absolutely.
certain demographics like we just touched on with like our fellow veteran folk with a Part B give back, or even people that are turning 65 and are rather healthy. This would be the absolute way to go with like an umbrella package
Yeah.
with with the Advantage plan and the hospital indemnity as something to definitely consider when it comes to your, choosing of how to properly protect yourself.
Yeah.
And the demographic would work with veterans. It would work with people turning 65
Hmm.
that are rather healthy, and also our own selves that are, younger and employed,
Yeah.
or even people that are, 63, 64 years old. You could
Hmm.
get yourself locked in at that rate,
Yeah.
and then it just your guaranteed issue on top of it between the ages of what is it again?
So it varies for each of the different carriers. I know, one of our most popular ones, and I'll kind of get into what, guaranteed issue means for those people who don't know. Guaranteed issue means that you will not be denied the coverage based on pre-existing conditions. So let's
Mm,
just say we're trying to get you into a hospital indemnity plan, and you are 75 years old. You're going to have to go through some medical questioning, and that's based on the carrier. Each carrier asks different questions, but one of the carriers, that has the highest range is Wellaby. It's Medico, and their range I think is 64 to 79.
I think it's 60 to 79.
I think it might be. I don't know. I'm not entirely sure. I'd have to
No, I
double
think
check on that.
I'm pretty certain it's 60 to 79, folks.
Okay, all right, 60 to 79. That is a large range. That's almost 20 years there. So you can get into a Wellaby plan, hospital indemnity plan, with no medical questions asked. I just the other day, actually, I talked to a guy. He had cancer and he had just had a heart stent put in.
Mm,
He was born in 1959. He was well within that age range for guaranteed issue. They're not going to charge or ask him any medical questions or charge him a higher premium. He was already accepted into the plan. I just got the confirmation the other day, and I think his premium, very affordable, was $38 to get him, with I forget what the exact amounts were, but he was all covered if he were to go to the hospital.
mm, gotcha. I
Yep,
mean, that's great that you were able to help him like that.
absolutely. Yeah.
Yeah, for sure.
Hmm.
Um, yeah. So, should we move along from hospital indemnity and move
Yeah,
on to the next one that we
we
should
touched a
go on
good
to?
bit on hospital
Sure.
indemnity.
Let's
Yeah,
go on to
so
the next one.
yeah, we're gonna transition into what they're called. The abbreviation is CHAS, which is CHAS, which stands for cancer, heart attack, and stroke. So the way that these plans work, and I want to preface this before I get into anything. These plans are, I feel comfortable offering them to anybody that can afford the premium every month. These plans help tremendously. We have heard, stories of coworkers. Chris just came and told us about how he had a call back from a client that told them that they were, oh my gosh, God forbid, they were diagnosed with cancer and they got paid out for I think it was $50,000 that they got paid out. So, the way that these plans work is it's very cut and dry. With cancer, heart attack, and stroke, there is a benefit amount that we can set to how much you will be paid out. God forbid these things happen. So let's just say, for example, $50,000, like the example I just gave. We could set it to that. And then if you were to get cancer, have a heart attack, or have a stroke, you would just be paid out. And this is important, 100% tax free lump sum check that you can use for whatever you'd like. It's the not being taxed, that's huge when you're looking at large amounts of money like that.
Yeah, sure.
It's not going to be taking out anything there at all. And like I said, last episode I talked about I have one of these for myself. I just the other day signed myself up. If God forbid one of these things happen, I'm going to be getting paid out 75 grand.
Right. And
So,
so it basically kind of covers like that $50,000, $30,000, $20,000, whatever slider it is that you choose to select. What it actually covers are things that are just not thought of when it comes to cancer, heart, and stroke, which would be the fact that you might have to travel from, say, if you're living in Tennessee, you may have to actually travel to New Haven, Connecticut. Shout out Yale, New Haven,
yeah.
right? But I mean, it's one of those places that
Hmm.
takes care of many different things when it comes to cancer.
Yeah.
And you may have to actually, move from Tennessee to New Haven, Connecticut for a short period of time where you would have to actually get, proper cancer care. And what would you do if you needed to pay for food, which the pizza's amazing, by the way, or lodging or
Travel, gas,
travel,
flights,
gas,
whatever it is. I
airplane
mean,
rides, whatever it may
yeah.
be, you're gonna have to come out of your pocket
Hmm.
for an extended amount if you're not properly covered like this. So that's exactly where like that windfall of money would actually help you put yourself at ease in such a trying time,
Yeah.
which obviously anything like a tragedy like
Oh my
that
gosh.
would
Yeah.
be. But
Hmm.
like at least you're setting yourself to be properly protected
Hmm.
for that
Scenario.
cause in life that
Yeah.
could be absolutely scary. And I mean, kudos to you for doing it at such a young age
Yeah.
because we don't know what's going to happen.
Yep.
And honestly, to the audience, I hope that speaks volumes that you're looking at a 25-year-old man who is, thought far enough ahead to take care of himself in such a way.
Yeah.
I mean, I have one set up as well.
Yeah.
I mean, I didn't do it through here, but I did it previous through like through USAA is the way
Right.
that I did it through.
Yeah.
Yep, I found out about it when I was in my TAPS class, in fact,
Ah.
when I was leaving
Simple
the
tap. Yeah.
military. Yeah, when I
Gotcha.
was
Yeah.
leaving the military, I
Hmm.
found out about the cancer, heart, stroke policy,
Yep.
and because I have a family history of heart attacks and strokes in my family, that I figured I would go and purchase one myself.
Yep.
I purchased it right around now I was a little older than you. I was about 32 or so when I
Right.
purchased it. And when I did, it cost me about I think it was $75 a month.
Yeah. Mine's 50. So that makes sense. So you're about 7 years old or so.
Right, and it was age dependent. I mean, obviously there's certain different factors as to, what it is that you would pay for like the premium. However, both of us being one that owns one,
Yeah.
we cannot be an advocate enough to our audience what it is that you could truly use it for.
Yeah.
And we're doing it. So, we highly encourage that. And when you do speak to us, we're going to go through a thorough needs analysis with you. You can expect a consultation to be anywhere between 45 minutes to an hour. So this way we can truly ask you the proper questions we need to help diagnose what your needs are and give
Yeah.
you a recommendation.
Yep. Yeah. And, like I said, with the hospital indemnity plans, we kind of emphasized how they work best with Advantage plans. I said this in the beginning. These are for everybody. These are people on supplement plans. These are people on TRICARE, Advantage plans, work plans, whatever kind of plan you're on. Just being able to have that peace of mind,
Oh,
knowing that you can have such a large payout
oh,
if these things happen. Really, I mean, I know I felt at ease, like, because I wouldn't, most regular, Americans, especially people that are on fixed incomes and stuff,
sure,
wouldn't be able to afford, one, the cost of cancer if they don't have the right insurance,
sure,
and two, the cost of travel and lodging and, whatever the cost is, they most likely can't afford all of it
sure,
during that time.
sure.
So having that lump sum untaxed straight to you.
Even if I could step in on that point
Yeah.
right there, even for the folks who can afford it, even if you can afford it, this is something that would help you even protect your money going further.
Yeah.
So this way you're not taking, whatever it is that you work so hard for your life for. Now you have to turn around and spend it. It just kind of makes too much sense to me as to, something that you would want to protect. And I mean, I can't emphasize this enough to our audience as something that we are trying to like really give you that outreach to. So this way you're properly protected because we don't know what's going to happen tomorrow. We're
Yeah.
not promised anything.
Yep.
My father, My father was he was diagnosed with diabetes. Now I understand that that's not the same subject, but he was 25 when he was diagnosed with that. My grandmother suffered from a stroke the first time when she was 41 years old. My
Oh,
sister suffered from a heart attack when she was 33 years old. I
yeah,
mean, these are real things that happen to people each and every day.
right.
And to me, it just makes great sense for what it is that you could really do to protect yourself and your loved ones from what the burden of the cost would be.
Yeah,
Because we do not think of these things ahead of time. We don't plan for these things to happen. We don't want them to happen, obviously. But what happens when it does happen?
yeah,
Are you prepared? That's a real question.
yeah,
Think you really should think about that, especially if you're listening and tuning into this podcast as to whether or not you're prepared for the possibility of a cancer, heart, or stroke to happen to anybody.
yeah,
And I just hope that this message is getting connected to our audience.
yeah.
Right.
Absolutely. And, and unfortunately, in your position, and, your family members that went through these things, they were all relatively young when this happened to them. And though, unfortunately, those,
And not prepared.
right, exactly, not
And not
prepared.
prepared.
Right.
Let me not prepared.
Yeah.
That's a big thing.
Hmm.
Like they were not prepared. I had to help my sister out with costs. Fortunately, she was able to go to a hospital in New Haven
Yeah.
because we lived rather close to it. But we had to go to it was luckily enough, it was close enough, but the cost alone from her heart attack on the outside parts with the babysitters I mean, I chipped in with that part obviously to help
Yeah.
babysit, but there were others that had to be paid for it. There was food that had to be paid for. There were the fact that my sister's bills got backed up.
Yeah.
I mean, it's what the mortgage stops.
And she was, if I can ask, was she working at the time?
Yeah, for sure she was.
Yeah. So that's another thing. A lot of people don't even realize, the loss of income after an incident like that. If you're pre-retirement age, if you're what'd you say? She was 41, 42?
No, that was my grandmother was 41. My
Oh,
sister was
okay.
about 33 when she had a
33.
heart
Okay. So
attack.
yeah,
About
obviously
that. Yep.
still working age. And, unfortunately that happened. And I'm assuming that she didn't work for quite a bit after that.
Of course. Right.
Lost the income and then,
She lost probably about 4 months of income.
yeah.
That's
Right.
a real thing. She
Yep.
lost about 4 months of income.
Yeah.
And that's a shock that just about the majority of Americans nowadays having a loss of 4 months of income. Where would you be?
Yep.
And even if especially if you're on a fixed income, where would you be?
Exactly. Exactly. Yeah, and then obviously this isn't to scare you guys at all.
No, no, of course not.
This is just the harsh reality of, the statistics and, how things are. And unfortunately, the statistics of these things happening only go up as you age. So that's why we really, want to emphasize people that are turning 65 is because that's when you're hopping on Medicare, and you're getting all your insurance set up. So this can be an easy one-time thing. We'll get you guys all set up. We'll be your agents here for life, and you don't have to worry about anything else. So that's kind of why we wanted to go there.
And most importantly, to inform you about what these ancillary products will do for you. Because, I mean, it's understood what's going on through like these challenging economic times. But at the same time, what would be more challenging? The fact that you're backed up now 4 to 6 months worth of pay, plus travel, plus food, plus this, plus the burden of having to go through the whatever medical
Yeah.
issue you're going through.
Hmm.
I mean, at least for nothing else, let us help you take that burden off.
Yeah.
I mean, that's kind of like just one of the big things that it is that I am an advocate for is to help you take that burden off and help you understand what it will do for you. I mean, that's the point of the podcast, isn't it now?
Absolutely.
Yeah, for
Yeah.
sure.
Yeah. No, I appreciate you saying that. So yes, just to reiterate, cancer, heart attack, and stroke,
For
highly recommend for
everyone.
everybody. That is, I very, very much believe in them. So we can kind of transition here, in the last couple minutes that we'll be doing this podcast, into we also offer for people that are on, mainly supplement plans. Obviously, we can still help people out that are on Advantage plans with these, but dental, vision, and hearing,
Also for employer coverage because some
and
people
employer coverage.
actually
Yeah.
lack dental, vision, and hearing coverage.
Yeah, anybody that needs dental, vision, and hearing that is watching this, please
Right.
call us. We'll be
Yes.
able to help you
We'll
out no
help you
matter
out.
what age. So, yes. So dental, vision, and hearing. One thing that I want to address on the dental side that is I guess, a common misconception would be that once you have dental insurance, you're covered immediately. That's the case in some areas, but there is a nuance to it. So,
Hmm.
when it comes to dental, a lot of the plans we look at, when you're looking, if let's just say, for example, you need dentures or you need implants, that is considered major dental work or comprehensive dental services. And a lot of these dental plans, a lot of these carriers make you wait. It's usually around 1 year from having the dental coverage from the first day to the 365th day for you to be covered fully.
Really?
Yeah. So for an example of this
Hmm.
would be, I just talked to somebody the other day, needed dental work bad. They needed some surgical extractions, which are different than simple extractions. And then they also needed a pair of dentures.
Hmm.
They would have only been covered for 20%. The company would have only covered 20% of that cost on day one.
Really?
For major dental services.
I'm learning something right now.
And then only after a year would they cover 50%. So, and then, it's for good reason. It's
Well,
so
wait.
people.
What is that reason? I'm actually learning something
Yeah,
right now
no, of course,
myself, because I
yeah.
don't touch too much on dental. So what is that reason?
Yeah, so that is just because, let's just say tomorrow, for example, you needed dentures.
Okay.
You could pay one time, get your dentures, cancel the policy the next day. And that is, that's not profitable for the company.
Uh,
They will,
I see.
obviously, it's just not going to work. They want to have a guarantee that you're going to pay your premiums. They need to make money. We don't come up with this stuff. Obviously, this is just the rules of how it works. But this is why preparing, the whole theme of this
Yeah.
is always preparing.
Sure.
If they would have had the dental coverage in place for a year before they needed it, they would have been fine. They would have had that 50% coverage rather than having to pay 80% out of pocket. So that's one thing that I really, really wanted to touch on and kind of clear up for people that are watching this that need dental coverage, is getting it sooner before you need something is you're going to be in a much better spot than if you wait until something happens and then you try to get it. So
I appreciate you doing that for us, because
course.
honestly, you gave me a lot of clarity when it comes to explaining like at least the dental part, which we haven't even touched on the vision and hearing just yet.
Right.
But for myself, I don't handle dental too much because
Yeah.
I'm a little more nuanced in like
Mhm.
what it is that we're doing,
Yeah.
for the agency. But at the same time, I really appreciate that
Of course.
explanation, because if I did have to fall upon that, I would be I
Right.
wouldn't be able to explain it like that. So
Yeah.
I
Well,
really appreciate that.
of course, yeah. And then, it makes sense. So a lot of people are like, oh, I need dental work done. I'll get dental insurance. Unfortunately, it's just not how it works.
Yeah, it just doesn't work that way.
Just doesn't work
You
that.
have to
That's
have
like,
it set ahead.
exactly. That's like
gotcha.
saying, for a cancer, right? If you wait until you get cancer, you're not going to get approved for a cancer plan because obviously you can't be paid out. You already have it.
Sure.
So that's the same kind of logic that the dental companies are using as well when it comes to that. But, we also offer some limited vision and hearing benefits as well that we can tap into if you guys need hearing aids or glasses, prescription glasses, contacts, frames, fittings, whatever. We can cover that as well. A lot of them are kind of just one package under an umbrella that we can get you guys hooked up with if you need all three. So definitely give us a call here at the Medicare team if you guys have any questions or are in need of those. So
Yeah, for sure. And one thing I would like to just make sure I touch on about the cancer, heart, stroke, to circle back to that
Yeah.
quickly. The one thing that I wish we were able to do would be to be the person to hand the check over.
Yeah.
Because I've had several phone calls come back to me
Mhm.
where I've been thanked about getting people on the cancer, heart, stroke policy.
Yeah.
And like, that's just the one and only thing I wish I could have. And I hope that you can see my face when I'm looking at the audience and saying this, that it's one of the only things, if I could enhance what it is that we do,
Right.
that I would be able to be the person to just fly out, drive out. I wouldn't care, walk out if I
Yeah.
had to. I'm a little crazy like that.
Right.
I walk right out to you just with a check in hand and be able to be the person to hand it to you.
Absolutely.
That's the one and only thing I wish I could have
Yeah.
that would come along with it.
Mhm.
And other than that, I mean, we can't thank you enough for tuning into this podcast. It's been a pleasure to be able to help inform you on some ancillary products,
Yeah.
and then I'll go ahead and turn it over to you,
Yeah.
TJ, and you can go ahead and sign off yourself. But thank you very much for your time and attention. Hope you really think this stuff over because it's rather important.
Yeah. Thank you, Jack, for being here with me today. Thank you all for tuning in. We will see you guys next time.